Good afternoon. With a quorum present, the Maricopa Regional Continuum Care Board meeting is now called to order. For those around the table, please turn on your microphone when speaking. For those participating via Zoom, please state your name when making a comment or asking a question, and mute when you're not speaking. The MAG public comment process allows members of the public comment on ideas on today's agenda or on items that fall under the COC's jurisdiction. If you would like to comment at today's meeting, please fill out a white request to speak card located at the information table and give it to MAG staff. For any of those board members or visitors today, if you parked in the garage, parking validators are available on the information table. If you purchased a transit ticket to come to the meeting, please see staff for a ticket. Hearing assisted devices are available for MAG staff. Katie, please take a roll call. Members of the board, please say who you are and the organization that you represent after Katie calls your name.
Thank you, Co-Chair Podlogger. Tish Brown Gambino. Jacqueline Campbell.
Here, U.S. Vets.
Thank you. Tad Gary. Lisa Glow.
Here, Central Arizona Shelter Services.
Thank you. Chris Hallett.
Here, City of Peoria.
Thank you. Michael Hughes.
Here, A New Leaf.
Thank you. Natalie Lewis.
Here, City of Mesa.
Thank you. Rachel Milne.
Here, City of Phoenix.
Thank you. Sean Pierce. Vicki Phillips.
Vicki Phillips here, CBI.
Thank you. Charles Sullivan. Danielle Wright.
Here, ACES TV.
Thank you. Chair Rob Podlogger.
Here, Valley of the Sun United Way.
With that, you have a quorum. Back
Great.
to you, Co-Chair.
Thank you. The next item on the agenda is a call to the audience. This is the opportunity for the public to comment on items that fall under the Continuum Care Board that are not on the agenda or that are on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience agenda item unless the committee requests an exception to this limit. Katie, were there any comments received or anyone who wishes to offer comments at this time?
There were no comments received, and at this time, we have not had anybody raise their hand looking to offer a comment.
Great, thank you. We'll now move on to the next agenda item. Our next item is the approval of the consent agenda. Items 3A through 3I are on the agenda for consent. Does any member of the board have questions, comments, or request a presentation of any of these items that you received in your consent agenda?
This is Michael Hughes. I would just like to say that very, very thorough and impressive. So, job well done.
Any other comments or questions? Great. Could I have a motion to approve the consent items 3A through 3I?
I move for
motion.
approval.
Move for approval for Michael. Can I have a second?
A second.
Danielle, right? Second. For board members in the room, we'll do a voice vote. Those in favor, please say aye.
Aye.
Those opposed, please say nay. Great. For members joining remotely, I will ask MAG staff to proceed with a roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Lisa Glow.
Yay.
Rachel Milne.
Yay.
A motion passes unanimously. Back to you, Co-Chair.
Great, thank you. The next agenda item will be updates. Given that we heard an update last week from all of our chairs, we included the updates in the agenda packet. We will discuss during our next strategic planning the best way to keep these updates coming to us, and we greatly appreciate the committees for their presentations. However, there's been quite a bit of activity at the legislature. So with that, I would like to invite Jonah Carr, Interim Executive Director with Arizona Housing Coalition, to provide an overview of legislative activity.
Thank you. Hi, everybody. To provide a legislative update, The session began on January 9th of this year, and there's been much activity since at the state legislature. I'm going to begin with the Arizona Housing Coalition's 5 legislative areas of focus, and then I'm going to provide some updates on a few more also. So the Arizona Housing Coalition this year, first of all, will be focusing on the State Housing Trust Fund. This is something that we have focused on at the state legislative session year on year since it was slashed back in 2008. But this year, we are requesting an increased appropriation into the State Housing Trust Fund, plus the identification of a diverse source of funding. A bill has been drafted by Legislative Council, and the language includes an ask of various funding sources, including 75% of unclaimed property taxes to go into the State Housing Trust Fund, plus an ask that any unencumbered dollars from the Arizona Finance Authority are transferred to the Housing Trust Fund as opposed to the Economic Development Fund, and a redirection of state lottery funds from the general fund into the Housing Trust Fund. So a little bit of a different focus this year, and the idea is rather than asking for an annual appropriation, as we have been doing, is really focusing on where funds can come from year on year and looking at more robust sources. However, the governor, Governor Hobbs, has proposed 150 million into the State Housing Trust Fund for 2023, which is an incredible step forward. This still has to pass budget hearings, but it's very promising considering where the Housing Trust Fund has landed in the last few years. The second legislative priority that we're working on or have been working on is the re-establishment of the Arizona Interagency Council on Housing and Homelessness. This council was formed originally under Governor Napolitano and brought experts on housing and homelessness together around one table. So this effort, the new effort, will re-establish the council and will bring folks cross-sector together around one table. Again, we jumped forward on this with the help of the governor. Governor Hobbs signed an executive order to re-establish the council. So the council will be co-chaired by our new department head of housing, Joan Service, and DES, Angie Rogers. So there'll be more updates on when those meetings will begin. But that's a great step forward. The other piece that we're waiting to hear about is the increase in the DES homeless coordination line item. This has received static funding over the years, and this is one of the few funding sources that we've had for shelter operations and housing program operations, which we know is a significant gap for homeless service providers and projects. So we need to make sure there's a robust increase in this resource. As of now, $1 million in lottery revenue plus general fund and TANF dollars have gone into that. So we'll be looking at other funding sources as a budget ask, as a priority. The other thing that we're working on is the teacherages bill. Some of you may have been familiar with this from the last session. Senator Kaiser just last week has introduced a bill and the language has been drafted. So this bill focuses on the ability of school districts to build workforce housing on school land. Currently, this is only possible by the way that the legislation is written in rural parts of the state. Vitalist has spearheaded this bill in the last session, and unfortunately it didn't pass, but Vitalist has done some really great work in the past year to build models and connect with communities and stakeholders to strengthen the bill. So it's now going to be introduced again, and it focuses on 2 separate things. The first, expanding school districts' authority to construct or provide housing facilities for teachers and other school employees to all districts, not just rural. And then allowing school district governing boards to enter into lease agreements for housing without the vote from their electors, because that's been a barrier in the past. Haven't seen a bill number come through for that yet. But if anyone is a member of the Arizona Housing Coalition, we are hosting our legislative policy committee meetings each Thursday now, every other Thursday through session, where we'll be providing these updates. So happy to provide that information to any members. A couple of other things that we are working on is the Housing Supply Study Committee. So in the last legislative session in 2022, a by right zoning bill was drafted with the purpose of encouraging local zoning reform and reducing the time for affordable housing projects to move forward. This bill turned into the creation of a housing supply study committee that met throughout the year to develop recommendations around zoning legislation. A report was developed through that, and I can share if anybody needs it or wants to read that. And that provided a number of recommendations. The bill language has now been developed, but we did hear late last week a rumor that the language isn't too much different from last year, and again, may need some work. So there might be quite a bit to do around that bill. That's as far as I know right now, and we're waiting for more information. The final priority of the Arizona Housing Coalition is the state low-income housing tax credit. We were successful 2 sessions ago for a bill to pass to develop a state low-income housing tax credit, which mimics the federal low-income housing tax credit, one of the major funding sources for affordable housing development. But there was a cap of funding for 2 years, and so this session we will be exploring opportunities to expand this low-income housing tax credit past the 2 years. And then aside from that, just a couple of other things to note. We are still waiting for a list of housing related bills from our lobbyists that will determine what else we're going to be tracking, supporting, or opposing. So that's going to come out soon. We'll be able to provide some more information. I do know that Dominium, who's one of our largest affordable housing developers in the state, are running a bill on the 4% low-income housing tax credit to make this more accessible to developers. So essentially that's related to increasing funding resources for affordable housing development. So we'll certainly be supporting that. And then the other piece, finally, that you may have all heard of is an effort by Cicero, House Bill 2284. This bill was introduced by Senator Livingston for the 3rd year. It's a very controversial bill. It's a bill that directs funding for the development of sanctioned campgrounds as part of a response for those experiencing homelessness. The major concerns around this bill are the redirection of funds away from housing and into encampment development, but also the role of law enforcement and essentially some criminalization pieces. The bill was set to be heard in committee last week and was held. It was then set to be heard today and has been held. There is rumor that the bill may not go anywhere. Waiting to hear more information, but as of now, I'm not really sure what's going on with that bill. I should know more in the next few days. And that concludes my update. Does anyone have any questions? Lisa?
Yes. Well, first of all, thank you so much, Joanna, and for all you're doing. It's a big agenda this year. I had a couple of questions on 2 bills in particular. The Housing Trust Fund. First of all, do you have a sponsor for that?
We do have a sponsor. Let me find out who that is. One second, I can pull that up.
And is there an amount? Does it mirror what the governor's ask is?
Our amount asked was 200 million. Yes. And I'm waiting to see whether that's included in the bill language, that ask. I need to check that, but that's the ask that we were going for. Yeah.
Okay. And as far as a sponsor, I know the deadlines are coming up. So I assume that, obviously that'll go in.
Yeah.
And do you anticipate, you mentioned the funding sources, the Arizona Finance Authority and state lottery are two of the three unclaimed property taxes. Do you anticipate any opposition, and how can we help?
Certainly anticipate some opposition. I think in terms of how we can help, is using the request to speak system kind of once the bill kind of moves forward. This is going to be a budget ask. So I mentioned our policy committee meetings that have been held now bi-weekly on Thursday. It'd be great if anyone who is interested in supporting and is a member of the Housing Coalition is attending those meetings, because that's where we'll be really having these discussions around how these bills are moving forward, and what we can ask the community in terms of support.
Yeah. And then the second bill, the DES line item, thank you for running that. Cass has sponsored a bill for 2 years to get some additional funding into that. And last year we thought it was going to happen. It got held. My understanding is that the ask is going to be 25 million this year, 25 million next year. Is that still the case?
Can I get back to you on that,
Yes.
Lisa?
Okay.
I'll have a look at the bill language.
Okay.
Yeah.
And do you have a sponsor for that one too?
I've not seen anything come through as of yet on updates. But I can check. We're meeting with our lobbyist firm tomorrow.
Perfect. Yeah, if you could let us know, because I think that's so important with the cliff, the COVID cliff, that we have a lot of people advocating for this, because those operating dollars are needed. I'm assuming cities would weigh in support of this as well, because they've been bearing so much of the brunt on operating dollars, and the county and others as well. So I would be happy to, I know we have the same lobbyist. We'll stay in touch on that. But thank you for stepping up and running that bill. That's all I have.
You're welcome. Thank you.
Joanna, thank you. Are there any other questions from board members? Joanna, I do have one question. When you were talking about the Interagency Council on Homelessness that is being reinstated, and Joan is going to be heading that up, do you know, or has everybody communicated a plan to build that out, and who is going to be invited to sit at that table?
The plan is being built out at the moment, I believe. I know that there's going to be a real focus on making sure that there's cross-sector collaboration in terms of who is invited. So representatives from state agencies, not just focused on housing and homelessness, but also access, Department of Health, etc. Just making sure that there's that cross-sector approach. Otherwise, I don't know, I anticipate that, there will be an ask of stakeholders and community partners who are working in the space on the ground. That voice will be very important. But I imagine by the time you have the next meeting, there'll be more updates on that. So I'll be sure to provide that.
Wonderful. Thank you. Appreciate that.
Okay.
There are no other discussion items. Let's go ahead and move on to the next agenda item. Again, Joanna, thank you.
You're welcome. Thank you.
Cleo Warner, the Human Services Planner with MAG, is going to provide an overview of the System Flow Dashboard.
Hi, everyone. Am I good to share my screen? Just kidding. I can't share my screen.
You should be.
Okay. All righty. Let's go back to the first tab here. Okay, we have our system flow dashboard. For anyone who is new to this or viewing it for the first time, this first landing page is super useful for the definitions that you have down here. If you have a question on anything, generally go to this definitions page first, and you can usually sort of tease out what things mean. I find it super useful all the time. Moving to our active overview, these are our numbers that we're seeing for December. So as you can see here at the top, we have our total number of active households. When you drag your mouse over the little points, you can see it break down into the person count as well to get a better sense of what that number means. We are seeing a continuation of this trend of like a general leveling out here. We have all households being a very small increase, singles, a very small decrease, families, very small increase. So like I said, you can spend time looking at what those exact numbers are. Moving down, subpopulations tell us further breakdown of what this leveling out means. We've certainly had varying activity across our subpopulations lately, as this month is actually quite dramatic compared to last month in what the changes are. So where we are seeing things remain fairly level, chronic, youth, and veterans, I would say is comparative to the rest, somewhat level. Where we are seeing some dramatic looking increases are at BIPOC as well as the elderly. If you scroll over our elderly numbers here, unless I'm reading something wrong, I'm pretty sure this is the highest number we've seen in our system since we've started recording here with these numbers and displaying it this way. So we are at 950 households. We have surpassed the June peak of 918. So I would say this number increasing is definitely the most alarming thing that is happening in our December numbers. We also saw a big increase here with our BIPOC populations. We are seeing a drop in unsheltered numbers. As you can see here, it's following sort of this general trend down. So we're continuing to see that reflected here in this dashboard. I'm going to move us to the flow details, and then we can get into any questions you all have.
Cleo, can you hold on 1 second?
Oh, yes.
Cleo, can you zoom in on your screen to make it bigger on your end? It is very difficult to see in the room. If you
Yes.
like Control plus on your screen itself, it may look a little funky. That's much better. Thank
Much
you.
better. Okay. Okay. Well, then I'll give you a second to look at those numbers again. If I need to zoom in any more, please let me know.
That would be great.
More. Okay. We good?
That's good.
Okay.
Thank you.
Sorry, everyone. Okay, so we're over at the flow details. We have another month of our inflow continuing to outpace our outflow. That's what we're seeing here in this graph. So when you drag your mouse over, you can get that breakdown of those numbers. Further breaking down who's coming back into the system, you can see here a pretty dramatic convergence of the numbers, or divergence, I should say. So the majority of this inflow is coming from a return from inactive, and new clients continues to see this downward trend. We also have return from housing remaining mostly level, but also small dip there. To the outflow detail, some good news. We have this very dramatic increase in total housed. I believe that's like a over 30% increase in number of total housed households. So that's a really amazing jump. It is the second highest reported month on this graph. Our other peak is 609 in October 2020. So this number is the second highest that we have recorded here, which seems like a really nice win for us looking at this dashboard. And then we have continuing of this general downward trend of a drop in unknown and negative exits. So that is a quick overview of our system flow dashboard. As a reminder for everyone, you can go to this little gear here and sort through by population if you're interested in any of these subpopulations specifically. Just a nice other way to sort of visualize what's going on. Questions?
Great, thank you. Any questions from the board? Great. Oh, yes, sorry.
Just that I would really like to see that more closely, just to be able to get access to it. So I don't know if the board itself can do that or has had that before, but I've never been able to really dig down into that and really look at it.
So I will say this is, oh, sorry, you go, Kitty.
So go ahead, Cleo.
I was going to say this is available on the publicly available dashboard on Tableau. So perhaps that is something.
This is available to all of you within the system. This is what rolls up into the system, the homelessness trends report on a quarterly basis. This presentation is given monthly to both the committee and the data committee. So if you want somebody walking you through this, you are more than welcome to attend either of those meetings. And then we bring this to you all quarterly before the system, the homelessness trends report comes to you the following month. You all have access to this link through your overview documents that were provided to you. If you need this link, feel free to send me an email and I can get it over to you if you don't have it.
Great, thank you. Any other questions or comments? Great, thank you, Cleo.
Oh, I think we have a question from Lisa.
Oh. Sorry, Lisa.
Yeah, hi there. This is really wonderful and useful. I'm wondering about, do you do anything in reporting the trends in homeless deaths? I know those are reported by Maricopa County. Is that part of what, or like, how is that being tracked? Or should we track it?
That is county tracking the transient death report. Katie, I don't know if we have any hand in that. I don't believe so, though.
That is, we rely on the Maricopa County Coroner's Office to report on that. However, if folks are reported as deceased in HMIS, that will populate into here. So slightly different ways of recording. Coroner's office is based off of who they're seeing come in their front door. Ours is based off of like knowledge of them passing away. And so that you will see in the outflow details if that is captured in HMIS.
Okay. Yeah, I don't know if it's something we as a board would find helpful to have that reported periodically. Something that we've noticed here at CAS, we've had a lot of clients that have been hit by cars and passed away. So there's some sort of a trend happening there, and it may tie into program solutions, safe parking places. I'm not really sure, but we're paying more attention to the trends in transient deaths. So just raising that to see if anyone else would want to see that. We do look at it the other way. I just think as this evolves, for us to consider whether we want some report on that quarterly too. That's it.
Great, thank you. Any other questions or comments? Great information. Thank you for that. And now we'll move on to the next item. Katie's going to provide an overview of the progress on Pathways Home, including timelines, partnerships, and next steps. Katie?
Thank you, Co-Chair Podlager. So as an effort to keep you all informed of the work of Pathways Home and in partnership with all of the local jurisdictions, we are bringing you this presentation before we bring it to Management Committee and Regional Council in February. So some of this will be a little bit redundant to you because it's your updates as well. So Rob comes with me and presents at Management Committee and Regional Council, giving an overview of some of the work that you all do to better raise awareness to city managers and mayors about all the work that is happening here too. So, and then I'll go through some Pathways Home updates. So quick overview of the continuum of care efforts. This big event happened last week. It was the point in time count. So we worked over 1,000 volunteers went out across the valley last Tuesday to basically count people experiencing homelessness and really ask them a series of questions. Both the unsheltered and the sheltered count happened that same day. We expect results for you all in mid to end of April prior to going live. So why does it take so long? We have to crunch all of that data, see if there is duplication, any efforts like that. And then we consolidate both the sheltered count and the unsheltered count for that evening, or I guess morning. Next big thing, which you all approved today, thank you. We revised so many policies and procedures, manuals, and forms, and all of those will be updated on our website by the end of this week. And then we are also working on revising performance standards in partnership with you all. You will hear more about that in February of really getting those performance standards for feedback and then hopefully approving by March, both in partnership with jurisdictions and also performance standards for the continuum of care. Want to highlight that website link for you all. Definitely trying to get as much on our website available for you all in a very easily and accessible way as much as possible. Moving on to the work of Pathways Home, there's been a ton of activity. This has been kind of the progressive action steps graph that you've seen over time. I'm really excited to acknowledge 2 of the 15 have moved to done. What? We're moving forward. So really excited that both of that is complete and really continuing to look at what does a phase 2 look like as we move forward. So a couple details on all of these. As you all know, we are kind of in the intermittent phase of both an HMIS evaluation and a coordinated entry evaluation that will be completed by the end of this quarter. In addition to the HMIS evaluation, we're also having continued discussions about data usage, access, and understanding. So really, who has access to the data? How do you get more access to data? And how do you understand that data so that it isn't just a bunch of points, but really diving into that data further so that everybody is understanding it the same way. And then really want to highlight the work that we're doing with outreach, looking at parallel systems of care that we're partnering on. So what does that look like from hospitals and the criminal justice system? So outreach cannot just be within our system, but to those other systems as well, because a lot of those folks are entering the homeless response system and we're their first response. Moving forward into coordination, I'm going to run through these. We're continuing to refine that funding filter to really understand how much money is going into homelessness from a government lens. So we've refined this to be really focused on government and from a federal level all the way down to state and then local. We're working on developing a set of informational guides in partnership with the local jurisdiction committee to really highlight prevention and diversion programs, understanding what do those mean and having consistent definitions across diversion and prevention programs. We're partnering with Valley of the Sun United Way on workforce opportunities and how to create a workforce map to understand where can we plug nonprofits into workforce opportunities and make those the most effective for people experiencing homelessness. And then finally, working with Home Matters on a public education campaign. We anticipate that those toolkits and related materials will go live in March. This Thursday, there is a feedback session for specifically looking at the visuals of that campaign. So a logo, things like that. If you are interested and have not received an invite, please feel free to reach out to me and we'll get that sent over to you. Want to quickly touch on House America before I dive further into housing targets. Really excited. The end of House America ended at the end of December, and we were able to rehouse 1,268 people and add 337 units into the development pipeline, which we did it. I know it was a little bit of it was definitely a reach goal, not something that we thought we were going to reach. So really excited that we got that all the way over the finish line, and really want to tailor that into where we're going with housing targets. So when we first started the plan, it was I think you have all heard me say this, that it was a standard plan that we looked at a point in time and then said we would reevaluate on a yearly basis. We're now looking at reevaluating that on a quarterly basis when we bring these presentations to you all. So we've made a ton of progress on the temporary housing side, basically cutting it in half, but less so on the permanent side because of how many more people have come into our system. And so I want to break those down a little bit further. And okay, that's better. Oh, Tyler, could you move that talking bubble? So thank you. Perfect. So looking at our temporary, in the middle is where you see stagnant. So we don't have more people or less people coming into the system. That's where I'll start, and then I'll move left and right. So at where we're at now, we need an additional 382 units of temporary housing while also maintaining all of the units that are currently in our system. As you look left, these are the additional units we need if we increase homelessness by 10% in the Valley, and then if we increase 20%. The reason I include the 10% and the 20% is over the last 3 years, we've seen an average of 10% more people experiencing homelessness coming into our system. But over the last year alone, we've seen an increase of 20%. And so we really need to work on how do we stop the folks that are coming in the system. And that's why I bring up the decrease in 10% and decrease 20%. So if we start to stop the folks that are coming into our system, then we need to create less housing in our system, both on a temporary side and a permanent side. That last column on your far right is the number committed by 2027. So we still have jurisdictions opening more units right now. 934 have been committed. However, that also means that we have to continue those. It cannot just be when we hit that funding cliff in 2024 that those units are no longer available. So this brings up a couple comments. We do have this funding cliff in 2024 that we keep talking about. We know ARPA and CARES money is going away. And so how do we consistently fund this number of units? During COVID, we created an estimated 1,710 additional temporary units. That almost doubled our number of units in the system. And with that, a lot of those capital costs are completed for right now, but operational costs are not covered on an ongoing basis. And eventually we're going to need capital costs once again to keep them up to the par that they need to be. So it's not, we can build it once, leave it for 30 years. We definitely have to keep those capital costs going. So this is an estimated dollar figure of just COVID created units. We are still further revising this. One of the things that we're revising on this is how many units how much more funding do we need, not including our pre-COVID funded shelters. So we know that just because we created COVID shelters doesn't mean we can shift our funding from what we used to fund to what we're currently funding. So this is definitely only a piece of the puzzle, and we're going to continue to refine this with partners and funders to say what is our total cost that we need on an annual basis. Want to show you those same graphs on a permanent housing basis. So if you start in the middle, that stagnant 1,382 units are needed. Those are on an annual basis. We need to keep this flow going. And if you shift to the left, 10% and 20%, we need even more units. And then on the right, decreasing units. And that committed by 2027 is 1,307. So that doesn't even meet our stagnant need. And those are committed by 2027. So that's not an ongoing till 2027. That's a one-time unit. So I bring us back to some of the challenges on the permanent housing side. So we had 956 housing placements in 1 year. So 956 of those 1,382. So we constantly need to backfill the units committed when, unlike temporary housing, when you open one unit, that unit can continue to be used over time. With a housing placement, it's used one time and then it's gone. And then we need to increase in order to meet demand. So we're still not, we have a mismatch between the amount of resources available and the amount of resources needed. Some of that may be how do we further use diversion and other placements like that, affordable housing needs, things like that, comparatively to housing placements. But it is something that we need to address that demand. That total costs a little bit less, 14.8 million. So less use because it is not an ongoing cost. Want to quickly touch on some phase 2 steps. So as I mentioned, we're about a year, just over a year into the plan, and some of those things have been changed to done. And we've also learned a lot along the way. So there's a couple of things that we're adding as part of the plan, adding the development of a 1 to 2 pager documenting the work of Pathways Home and changes from the previous quarter. So you all will start to see that in your packets during this next update in April. And then that will also be available on our website for folks to be able to download and see the progress. Further telling the success stories of the work of Pathways Home. So really what has happened from Pathways, we've done a lot of really good stuff. I've showed you some of the statistics and things like that, but that doesn't truly tell the story. And so we're working on developing a series of blog posts and success stories based off of the work of Pathways. And then a couple other things, cross-learning from others on alternatives to emergency responders and further sharing the data between the emergency response system and the homeless response system. This really came out of completing the community court toolkit. We felt like that was a good first step, but there is more to be done in the work of working with the criminal justice system and first responders within the work of Pathways Home. Okay, next steps, couple next steps. Here's a series of upcoming meetings. You all are more than welcome to attend any of these meetings as our management committee and regional council. We will also be further working to refine some of that funding cliff that is coming and how to refine those numbers so that we can have a really clear picture as to what's to come in 2024. So with that, I'm happy to answer any questions.
Katie, I have a question. I sometimes wonder if people, do they really grasp the significance of quote funding cliff? What exactly does that mean? You know, it's used so broadly, and yet there's aspects to it that are very, I guess, profound, and yet not, in my opinion, easily understood at all. When you know, 2024, what does that mean in the end? How much? Can it possibly be extended? What would we have to do to lobby, you know, for the cities to have more time, the federal government? What your thoughts on that? Or
I think it's definitely something that we are working on further educating, but it is truly a cliff. And I think what we are working on is how do we build the bridge? So how do we make those asks to cities, county, state, federal, to be able to bridge that funding? And part of it is understanding what is the total amount of funding that is needed. So I think some of the question is, or some of the response is, there isn't going to be asks to city councils, to state government. Like, I think it is a yes, 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 instead of a like, we are choosing who we ask, because I think we just need more money overall. But I think the other side of it too is like, how do we effectively use the 1115 waiver from Access? Because some of that can be paid through it. And so I think one of the things that I've been like kind of furiously working on since December is, what are the numbers? Who can cover these funds? I think in partnership with the coalition, how are we making that ask to state? How are we making that ask to the legislator? But I think that is there. My hope is that there's a lot of education over the next 6 months so that we still have a year to figure out what does that look like before this cliff truly happens, because there is not additional federal money, which is where a lot of this resources come from right now. Does that help?
Great. Any other questions or comments for Katie? Yes.
Can I just add something to what Mike was saying? And I don't even know if this is even a possibility, but I just want to put it out there as something to think about. But as the cities and towns and the county are now starting to get opioid use disorder settlement dollars, there is synergy with our homeless population there. And I just wonder if that might be part of the solution, to find ways to use a portion of that funding that would be a direct service for this population that happen to be homeless as well.
Thank you for bringing that up. I think that's a really good point. We were just talking this morning in our office about what does that look like, and is there what percentage of overlap is existing? And there is a lot of opioid usage that we don't necessarily have an answer for. And so is that the pocket, and how can we start to tell that story to have that be some of the funding that's used?
Great. Any other questions or comments? So I do. Oh, yes, Lisa?
Sure. Yeah. Katie, I just had a question on two of the slides. The cost data for stagnant scenarios for temporary and permanent housing. Is that a capital cost amount or an operating cost amount?
That is an operating cost amount.
And so that's starting, is it like a 1-year operating cost for those projects?
Yes, that is based off of a annual budget.
So to me, I don't know if that's a way we can do an estimate, and this is just for Maricopa County, of course, for the emergency operating costs too, so we can start to get a handle on sort of cliff funding. To me, that might be helpful on that $50 million DES line item bill that I think was mentioned earlier and that I think we need to get behind. And we have the perfect opportunity, in my view, to really lobby for that, given here's all these locations that have opened, cities are putting in millions, counties putting in millions, and this was an opportunity for the state, especially if some of that funding is coming out of the lottery, there's no real impact on the general fund and that kind of stuff. So is there a cost scenario for operating dollars that could be put together on emergency shelter that, because this, I don't know exactly how this was put together, but could we do something like that?
That is what we're working on further refining. And I think all of these cost analysis are based off of data that we collected in the forming of Pathways Home. So we went to a lot of shelters and went on a per bed usage. What was the cost to operate a per bed? We went one of two ways. We either did what is your total budget and how many people are you serving, and then breaking it down, or vice versa of by person and then going up. And so a lot of these are estimates from about 1.5 years ago, I will say first. And then the second thing is when we pulled these estimates, a lot of the models that we currently have in place weren't exactly in the same way. So for example, we had like rented hotels, but we had only 6 months of data. And now that has changed because we have more bridge hotel models with different cost estimates. So one of the things that we are working on is further refining that and then figuring out a total based off of both pre-COVID shelters and COVID shelters that were created during COVID to really get a full picture of, because that 50 million is really just or 48 million is just the like COVID created and not even as reflective as current numbers. And so we're working on further refining that both with funders and with nonprofits to refine.
So under the temporary housing, does that include emergency shelter within that, or is that transitional, or both?
Temporary housing, how it's defined in Pathways Home, is emergency shelter, transitional housing, and bridge housing. So that would include like hotel, motel, even if we are renting or if we own the hotel.
I would like this committee to consider that we find a way to get that number as really fleshed out quickly so that we can support the legislation the Housing Coalition is running with a dollar figure, because 48,000 a year, if that's an accurate number, and the ask is for 48 million, sorry, 25 million this year, 25 million next year, seems like very reasonable. And I think it's going to take a concerted effort to get that passed. So I don't know, Katie, if there's any way that it could be expedited, because the session is here. And I think we have a good shot at something. So what do other folks think about that? I'd like to put it out for discussion.
I think it's a good point. I think it's a good point that you're raising.
Okay, thanks.
I think in general, my perception is there's a lot of education and awareness that's happening right now across the landscape of different opportunities. And as we're starting with the new legislators and the governor, bringing these topics up in our appropriate panels with the lobbyists and different things are going to be helpful. I think some of it's going to be coming from this, from individual cities also. And I think it dovetails back into Michael's comment earlier about the awareness and understanding of the overall cliff, and do we really even know what that means? So to me, it's a puzzle with lots of different pieces of the puzzle. And I believe that we have the right individuals around the table and on Zoomy and connected to others that can help continue to bring awareness to that. So I think now is the right time because it's not a tomorrow decision, but it's a decision over time. So thank you for bringing that up.
I'm happy, Katie, to volunteer to help out with this because, as I said, we'll be lobbying for that funding to be put in. And I love the work that you've already done foundationally, and it's probably a much higher number than 48 million. But I think that's one of the things that the legislature they'll want is detail and numbers and what is this an unlimited amount of funding every year you're going to ask for, but what really would the impact be? So I'm happy to work with you or others and the Housing Coalition too, because I think this is excellent, the foundations you've already laid for this.
Great. And I think Joanna has dropped off the call, but if not, you're right, Lisa, the coalition would be a great avenue since they are in the middle of that on a daily basis. Great. If there are no other comments, I do want to make one myself. And this is not to omit anybody, but it's really to highlight what I saw on the 24th at the pit count. And I wanted to express specifically to Kelly, to Katie, to the team here that was out. I know, Rachel, I got a chance to spend some time with you. It was my first pit count. It was, Katie and I had the opportunity of having a New York Times reporter and photographer follow. So I tried to take a step back because I think 4 people talking to an individual could be overwhelming. Me talking to 4 people one time is overwhelming. So I can only imagine what that would feel like. But Rachel and Kelly and Katie specifically, how you worked with these individuals, how you knelt down to be on eye level, to have conversation, to ask them the questions, very humbling questions about where did you sleep last night, and then continue the discussion. To see some of the individuals that you could tell were having mental situations and or drug situations potentially, but be able to observe that. I wanted to just personally, as a resident of Phoenix and Maricopa County in general, thank you each for what you're doing. As for partners in this work, it meant a lot. And then I ended that day back at VSUW with Kelly and Rachel, and we had Jeff, who is the director for the Interagency Council on Homelessness out of Washington, D.C., stopped in to debrief with my team. And I can let you know that we have a team of fundraisers. We have a team of individuals that sit out and work with the community. We have a group of individuals that are in the back office doing processing. I do not believe that I've ever seen a group of individuals so worn out emotionally from from experiencing that process. But the next day when they went home and got to decompress, every single one of them that I ran into wants to do it again next year. And so for everybody else who is involved in that, and whether you were within your community or not, I highly recommend doing that and hands off to everybody who is organized. So I wanted to just make a public statement. Thank you. And with that, we have the next agenda item is the election of a co-chair. Vicki Phillips has expressed interest in becoming the co-chair. I don't have comments that I'm supposed to say, but I guess I'm just going to go ahead and say them anyway. Am I allowed to do that? Great. The microphone's still on, so you haven't taken it away from me yet. So part of this opportunity over the past year has really been to work together with everybody as we're moving this work forward internally and externally. And when Vicki and I were having conversations over the past couple of weeks, I am beyond thrilled that she wanted to raise her hand to be a part of this because I believe that skill set, experience, and what you can bring to the table, it's going to be an added benefit to all of the work that we have going forward. So as long as you're still willing to raise your hand, okay, I didn't scare you away. Could I have a motion to approve Vicki Phillips as the co-chair of the COC?
I'll move to approve Vicki as the co-chair of the COC.
Great, thank you. Can I have a second?
This is Chris. I second.
Great, thank you, Chris. So can I have, my gosh, you have to do a roll call.
No, you have, are you reading?
You just gave it to me.
Is there discussion?
Okay, sorry. This was like hot off the presses when I walked in today. Is there a discussion of the motion? No discussion. Vicky, I'll ask you to abstain from the vote. For board members in the room, we will do a voice vote. Those in favor, please say yay.
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 Any, those those in the office, in the room, those opposed, please say nay. Great. For members joining remotely, I'm going to ask Katie to proceed with a roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Tish Brown Gambino,
Yay.
Lisa Glow,
Yay.
Rachel Milne,
A very enthusiastic yay. Thanks, Vicky.
Charles Sullivan.
Yay.
Awesome. That motion passes unanimously.
Great. Thank you and congratulations.
Thank you all very much.
Katie will be in touch with you with all of your scheduling that we will work out together. And I'm thrilled to be working with you. Thank you. Okay, moving on to the next agenda item. Each year, the Continuum of Care is required to complete an annual gap analysis. I wanted to turn it back over to Katie to give a brief overview of the annual gap analysis and hear your feedback from all of you on what you'd like to see from the gap analysis and the next steps. Katie?
Thank you. Co-chair Podlogger, no longer chair. Every year you all are required, part of your requirements of being a Continuum of Care board is to complete a gaps analysis. MAG staff is here to support you in that gaps analysis, but ultimately want to hear from you all as to what that looks like and kind of what you hope to see from that gaps analysis. So in the past years, last year and the year before, we used a lot of the regional strategies and regional action planning to identify the gaps in our community and really start to create some of that kind of background and framework for what does gaps look like in the Maricopa Regional Continuum of Care. Prior to, and even I guess 2 years ago when we hired Home Base, this has been an external contract that we have hired year over year. Looking for feedback from you all as to if you are looking for an external partner to come in, this can look like, or if you all would like MAG staff to carry this forward. This gaps analysis can be a series of things. It can be focus groups, it can be interviews, it can be looking at data analysis. It really is up to you all to give us feedback on this and to give direction. I am happy to have this conversation in this space or to give you all time to think about it, and we can discuss this during your strategic planning session, but would be remiss if I did not at least bring this up to you because it does need to be completed in this year.
Any conversation, comments based off of what Katie presented?
I would just say I agree with discussing that in the strategic planning session where we can really hash out some of the details and figure out what's going to be best.
Any other thoughts or comments? Does that sound like an agenda item we can add to the strategic planning meeting? Yeah. Getting a lot of heads nodding yes, so let's go ahead and do that. Is that it? Great. Thank you for your feedback. We're going to continue to discuss next steps and develop a project plan for completion of the analysis. So moving on to the next agenda item, do board members have any action or discussion items for future meetings? Quiet group. Thank you.
I have a
Yes.
question. I was asking Katie earlier, the number of board members, we have 13, and we're on our charter, you're allowed to have 17. Is there any movement to increase that number? Is 13, is there a minimum that we have to continue to make sure we're at that number, or where do we
Yeah.
stand with that?
So this is something that you all revisit in your charter each year, is how many members are on the board. So this was actually just revised last year. You initially had 15 as your cap, and you just moved it up to 17 last year and changed the designation of your seats. Each year, you open recruitment once per year. It often happens in the August timeframe. That has also been a discussion among you all, but from a capacity lens, we've asked that it can be considered once a year. If you fall below 9, you automatically do open recruitment. So that is a consideration. You all can ask us to open it sooner, but typically you open it each summer for additional board members. The other time that you mandatorily open recruitment is when you lose an entire grouping of seating. What do I mean by that is, if, say, you lose all of your jurisdiction funders, then you would automatically open seats. So you do have like groups. It's like somebody with lived experience, funding from a municipal lens, non-municipal funders, COC providers, advocacy, and community seat. So if you lost all of the folks in that, you would then automatically open recruitment too. We keep an eye of all of that in the background, I promise. And then going back to your first question of, can that change? Yes, that is a decision by you all as a board. When we revise charter, you'll have a charter work group that's specifically working through some of those nuances, and then bring feedback to the full board to consider adding additional seats. One thing I will note, if you add additional seats, your status of quorum is based off of having half rounded up. So if you say you have 25 people on the board, you have to have at least 13 people in your meeting. So one potential complexity when you do add additional seats.
Thank you.
And and correct me if I'm wrong, from an overall review process standpoint, MAG takes care of making it public on when that occurs. And so we want to be sensitive to trying to do it just once a year, but ramp up. And then that way, if some needs are leaving, we still have that cushion. So great, thank you. Any other action or discussion items for future meetings? Great. Next for the agenda is comments from the board. Is there anyone on the board that has any announcements or events that they would like to highlight? No announcements or events that anybody wants to highlight? Okay, perfect. So Katie has sent out an invite for our next board strategic planning session that is going to occur Monday from 2 to 4. The session will be hybrid with an encouragement to attend in person. Okay.
A week from today.
I just wanted to make sure.
It's on your calendars. You all have it.
A week from Monday, 2 to 4. And if there's no further business, the meeting is now adjourned. Thank you, everybody.